In this video, we're going to show you how to control who can see which patients. The idea is simple. Patient information should only reach the people who need it. In Velastria, a practitioner sees their own patients automatically. But a clinic is a team. Sometimes you need other people, a nurse, an anaesthetist, a coordinator, to see a patient as well. And sometimes you want to keep a patient hidden from people it does not concern. Teams are how you get the right patients in front of the right people and nobody else. Let's start with the building blocks. First, users. Every person who logs in is a user, and each user has one role. Some roles see every patient: the owner, the practice manager, a patient care coordinator, and your receptionists all see everyone because they run the front desk and the diary. Practitioners are different. A surgeon, doctor, nurse, anaesthetist, or therapist only sees their own patients. Next, locations. These are your clinics and theatres, like a Mayfair clinic, a main site, or a theatre suite. Every appointment happens at a location, and as we'll see, you can give someone access to a whole location's patients in one step. Now, the first kind of team, a clinical team. This is a clinician's regular support staff. When you add someone to a surgeon's clinical team, they can see every one of that surgeon's patients, past, present, and future, without you adding them to each patient one by one. Use it for a surgeon's regular nurse, their anaesthetist, or their secretary. The second kind is a location team. Instead of following a clinician, it follows a place. A person on a location team sees every patient with an appointment at that location, and the list stays up to date on its own. This is perfect for a site coordinator. Adding them to a location team scopes them to that site, even if their role would normally see everyone. So before we touch a single button, remember the people who always see everyone. The owner, anyone marked as a super user, the practice manager, your patient care coordinators, and reception. They all have full access by design. Everybody else only sees the patients you give them. And here's the rule that ties it together. Access adds up. A practitioner starts with their own patients. Add any clinical teams they belong to. Add any location teams they belong to. A person sees the combined total of all of those, and nothing else. If any one of them grants access, they're in. Now let's set this up in Velastria. Teams live in staff management. Open it from the access area, and across the top you'll find a tab called Clinical Teams. Let's open that tab. Click Clinical Teams. Here are both kinds of team side by side. On the left, in purple, clinician-based teams, one for each surgeon. On the right, in teal, location-based teams, one for each of your sites. The panel at the top reminds you of the rule we just covered. A person's patients are the combination of every team they're on. Take Richard Pemberton's team on the left. He already has a nurse and an anaesthetist on it, so both of them can see every one of his patients. To add someone, you'd click Add Member, choose the staff member, and pick what they do on the team. We'll open it to show you, then close it without changing anything. Pick the person, choose their care role, and they immediately inherit that surgeon's whole patient list. We'll close this without saving. Now the right-hand side, location teams. Our Mayfair clinic already has a coordinator, Olivia, who can see every patient booked at Mayfair and nowhere else. Adding a coordinator to a site works exactly the same way. Click Add Member, pick the person, done. Choose the staff member and they become a coordinator for that site. Again, we'll close without saving. There's a second, even quicker way to set up a site coordinator, straight from the locations page. Let's open it. Each location has an edit button. Open one up, scroll down inside the location and you'll find patient information access. The names on the left already see this site's patients. The names below are everyone else. Click a name to make them a coordinator for this location, and they get two things at once: the location's calendar and the records of every patient with an appointment here. Click the cross to take that access away again. Changes save the moment you click. That's how teams work in Velastria. Owners, managers, coordinators, and reception see every patient. Practitioners see their own. To extend access, put someone on a clinical team to follow a surgeon, or a location team to follow a site. either from staff management or straight from the locations page. Access always adds up, so the right people see the right patients, and nobody sees what they shouldn't.